All right, let's jump right into this explainer and uncover those fascinating, often completely silent clues your body might be sending you way before you even realize something's off. We usually think of illnesses as these loud, disruptive events, right? Like a sudden fever or a broken bone. But sometimes the most serious conditions, they start out as just a whisper. So today, we're basically playing detective to decode these silent warning signs of early diabetes.
Seriously, have you ever wondered if those annoying everyday little things are actually your body leaving hidden messages about your health? I mean, we're all busy. It's so incredibly easy to just brush off a minor ache, feeling a little extra tired, or a sudden craving, and just blame it on, getting older, or maybe not drinking enough coffee, or just a really stressful week at work. But the truth is, your body is a highly communicative machine, and it might just be trying to warn you about a massive metabolic shift happening right beneath the surface.
And the sheer scale of this mystery is honestly staggering. We're talking about millions of people living their day-to-day lives with this condition completely undetected. Because those early symptoms are just so mild, people can go for years without a formal diagnosis. And the real danger here is exactly that silent part. Because while it stays hidden, untreated high blood sugar can cause this slow, progressive damage to your heart, your kidneys, your eyes, and those really delicate nerve endings.
Let's kick things off with Section 1, the silent threat, the science behind it.
Okay, so normally your body breaks down the food you eat into glucose, sugar, basically, and your cells use that as fuel. Simple enough, right? But with diabetes, this vital process just breaks down. Extra sugar enters the bloodstream, but your cells can't effectively absorb it. It's kind of the ultimate biological irony. Your cells are essentially starving for energy while literally floating in a vast sea of unusable sugar. And because of this, your body starts hitting the panic button and setting off a whole series of biological alarms. Which brings us to Section 2, Everyday Clues, Signs to Watch For. Now, any single one of these common warning signs could super easily be blamed on a tough week, but they're actually deeply connected to those biological alarms we just talked about. If you're constantly thirsty, like a dry mouth that literally no amount of water can fix, and you're running to the bathroom nonstop, especially having to wake up in the middle of the night, that's your kidneys working in overdrive trying to flush out all that excess sugar. Meanwhile, your poor starving brain keeps signaling that you need more food, which leads to this increased gnawing hunger. And without that cellular energy, you're just left with this heavy, inescapable fatigue, even if you just got a full 8 hours of sleep. Now, here's a symptom that really tricks a lot of people. You might actually celebrate dropping a few pounds unexpectedly. But if you're eating normally, or maybe even eating more because of that increased hunger, and the scale is still dropping, yeah, that is a massive red flag. Your body is so desperate for fuel that it's basically gone into an emergency state. It starts breaking down your fat and your valuable muscle tissue for energy, just because it can't use the glucose in your blood. This next one is another really fascinating, though definitely alarming, mechanical effect of the disease. High blood sugar doesn't just zap your energy. It actually acts kind of like a sponge, pulling fluid from your tissues. And yep, this includes the really delicate lenses of your eyes. This fluid shift can actually temporarily change the physical shape of your eye's lens, which makes your vision totally blurry. So if your vision suddenly changes or it seems to kind of come and go, don't just automatically assume you need a stronger prescription. Your eyes might actually be signaling a major blood sugar spike. Moving right along to Section 3, Skin and Nerves. Physical signals. Okay, so if you start noticing that small cuts, scratches, or even just little blisters are taking literally weeks to heal, you really need to pay attention to that. See, excess sugar in the blood essentially makes your blood thicker and stickier over time, and that damages the lining of your tiny blood vessels. This damage drastically cuts down on vital blood flow, which makes it incredibly difficult for your body's natural repair crew, like your white blood cells, to actually reach the site of a wound and do their job. And that's not the only way high blood sugar affects your body's largest organ. Having all that excess sugar literally turns your body into the perfect, sweet little environment for bacteria and fungi to just thrive in. This leads to frequent and super stubborn skin infections, urinary tract infections, or yeast infections. And on top of all that, because diabetes messes with your circulation and pulls that fluid from your cells, it absolutely strips your skin of moisture. That leaves it unusually dry, tight, and just intensely itchy. Now, understanding the long-term impact on your nervous system is absolutely crucial here. Do you ever feel this mysterious tingling, or maybe a pins and needles numbness, or even a burning sensation in your hands or feet? Well, over time, those toxic levels of blood sugar actually damage the protective coating of your nerve fibers. This is what's called diabetic neuropathy. And catching the signs of diabetes early is just absolutely essential to stop this very serious complication before permanent, completely irreversible nerve damage sets in.
All right, here's a highly specific, very visible clue that so many people completely overlook. They mistakenly think it's just a hygiene issue or maybe a sunspot, but it's actually a condition called acanthosis nigricans. It shows up as these dark, velvety patches of skin, usually right in the creases of your body, like the back of your neck, your armpits, or the groin. Guys, this isn't dirt. It's a major, direct signal of severe insulin resistance. That means your cells are actively rejecting insulin, and it points to a highly elevated risk for developing type 2 diabetes. We also really need to talk about what happens when things escalate to a critical level. If diabetes goes undiagnosed, your body starts burning fat at this rapid, totally uncontrolled rate, producing really high levels of blood acids called ketones. And this can result in breath that has a distinct, persistent, fruity smell, or even smells like nail polish remover. Now, unlike being on a controlled keto diet, this is actually a sign of a life-threatening condition called diabetic ketoacidosis. If you or a loved one ever notice this, it absolutely requires immediate emergency medical attention. No questions asked. Let's jump into section 4, decoding the signs and assessing your risk. Okay, let's just pause here and take a deep breath, because this is incredibly important. If you're watching this and mentally checking off boxes right now, please don't panic. Having one or even a few of these symptoms definitely does not automatically mean you have diabetes. There are so many other highly treatable conditions that can cause these exact same symptoms. We're talking everything from simple dehydration to thyroid imbalances or even just a standard everyday infection. The whole goal of this explainer isn't to cause you anxiety. It's just to give you the knowledge you need to stay informed. However, context is pretty much everything when it comes to your health. If you've got persistent symptoms and you also happen to fall into any of these risk categories, like being physically inactive, maybe having a family history of the disease, or having high blood pressure, then your body is practically begging you to pay closer attention. And depending on your local screening guidelines, just being over the age of 35 or 45 naturally elevates your risk too. This is exactly why routine health checkups are so absolutely vital. They catch the stuff that we might just miss when looking in the mirror. Which brings us to our final section, section 5, taking control and prevention. Look, the absolute worst thing you can do is just sit around and wait until these silent whispers become loud, really severe complications. You don't have to guess, and you definitely don't have to worry in silence. A quick, incredibly simple blood test, like an A1C or a fasting glucose test from your doctor, is literally all it takes to get the real truth. It gives you clear, actionable data about exactly what's been going on in your bloodstream over time. And honestly, here is the genuinely fantastic news. If you do go get tested and find out that your blood sugar is creeping up a bit, it is very often not too late to turn the ship around. Early diagnosis, when you combine it with powerful everyday lifestyle habits like eating a balanced diet full of whole foods, keeping your body moving with regular exercise, maintaining a healthy weight, and really prioritizing high-quality sleep, can make just a massive difference. For a lot of people, these changes alone can successfully manage the condition and completely prevent those serious complications we talked about earlier. When you think about it, your body is just this incredible, highly complex machine that's uniquely designed to leave you clues when it needs a little help. It doesn't want to break down, it wants to thrive. So ask yourself, if the check engine light on your car was flashing, would you just slap some duct tape over it, or would you take it to the shop? Please, don't ignore the whispers of your own biology. Listen to what your body is telling you. Go ahead and schedule that checkup and take back control of your health story.